Hi, I'm Dr. Sujatha Mohan, Executive Medical Director of Rajan Eye Care Hospital. I'm also a phaco-refractive and cornea specialist. Today, I'm going to speak to you about a condition called keratoconus. What is keratoconus? Kerato means cornea, conus means conical. So we're going to talk to you about a condition called conical cornea. So how does the conical cornea come? What are the causes of conical cornea or keratoconus? What is the age it manifests? What are the reasons it happens? And most importantly, how do you manage it? So that is what we are going to discuss today. So keratoconus was usually seen around the age when the children started becoming from children to adolescents. That is around the puberty. So somewhere around 12 to 13 years. But now we tend to see them much younger, that is in the pediatric age group, as young as 5 years. And why has this happened? This has happened because of too much of computer gadgets being used, because of the online classes which were going on through the epidemic. This results in a dry eye. So the main cause for a keratoconus of this nature is a dry eye, which causes the children to rub their eyes. So the constant rubbing of the eyes thins the cornea and the cornea starts bulging out. So this is what happens in a pediatric keratoconus. Of course, there are other reasons as well, like consanguineous marriage, where the parents are very closely related. So this is again a major problem in our country, where there are a lot of marriages amongst close relations, and there could be a family disposition, that is a family history of keratoconus. So these are some of the conditions which can cause the keratoconus. So what are the symptoms of keratoconus? Usually the patients with keratoconus complain of poor vision, ghosting or doubling of images, and their inability to focus properly. They have a lot of glare as well when they go out in direct sunlight, because the cornea is not able to focus. The beam of light which enters into the cornea is not able to get into a single focus. And there are usually multiple focus which cause the eye to result in glare and ghosting. So the treatment, there are various treatment modalities available for keratoconus. The most important treatment modality which is available today, which was discovered about 15-20 years back, is a treatment called collagen cross-linking, in which the cornea is strengthened using a combination of riboflavin drops with UV light. It's a simple outpatient procedure and can be done in any age group, irrespective of the age, though there are different modifications based on the age, and this produces strengthening of the cornea and prevents any further worsening. But inevitably, in children who have keratoconus at a very young age, there can be a recurrence in spite of doing this collagen cross-linking treatment. So it's very important to emphasize that they have to be given adequate lubrication, to use drops if they are still using computers, and not to rub their eyes. So avoid rubbing the eyes should be the mantra for people who have keratoconus. The other modalities which can be done for keratoconus are where in advanced keratoconus where you can do a treatment called Intax, where PMMA rings are inserted into the cornea to produce a central flattening so that the cone flattens out a little bit, giving better quality of vision. There is another treatment called CARES, in which a tissue which is taken from the donor is inserted similar to an Intax, and that also improves the quality of vision. But all these treatments should be definitely accompanied by the strengthening treatment which we discussed earlier, the corneal collagen cross-linking. In patients who have very advanced keratoconus, which extreme thinning of the cornea, the only respite to this condition is doing a corneal transplant. So in these patients, the corneal transplants can be done either a full thickness penetrating keratoplasty, which was formerly done about 15-20 years back. Now most of these patients undergo a lamellar keratoplasty, what is called as DALK, or deep anterior lamellar keratoplasty. So there are various modalities of treatment in patients with keratoconus, depending upon the stage at which they present, and also whether any other previous treatment has been given, or whether they have any comorbidities, like I was telling you about the computer usage which can cause eye rubbing, patients with allergies who tend to rub their eyes a lot, or patients who have a family history, or patients who have other systemic disorders which can cause a weakening of the collagen in the corneal stroma. So all these things can contribute. So based on their requirement, whether a simple conagen cross-linking or whether it has to be accompanied by other sight restoring measures has to be decided. And most importantly now, there are wonderful contact lenses available which give excellent quality of vision after the cross-linking treatment is done. And this restores almost near normal sight in most of these patients. So we have specialized contact lenses for keratoconus, which neutralizes the cone or the asymmetry in the cornea and gives excellent quality of vision, very similar to a normal eye. So this is just a beginning about keratoconus. There are a lot of things that we need to learn. But before I wind off, I would like to say that even anybody who has a high astigmatism has to get screened irrespective of their age, because now with the computer age, with almost everything being done on the computer, the chances of dry eye increases multifold, and this results in patients rubbing their eyes and resulting in keratoconus or conical cornea. So that is one very important thing I'd like to emphasize. If you're using the computer a lot, please use some lubricating drops. And children who have eye astigmatism should be screened for keratoconus, because there are special tests for keratoconus. It's not like a regular test that we do. There are special tests for keratoconus to rule out keratoconus, because early treatment avoids further worsening and thinning of the cornea. So these patients have to be identified early, particularly in some patients where they have a habit of rubbing only one eye. So there is a progression of keratoconus only in one eye, and the child is able to see clearly with the other eye, and he's even unaware of this condition. So it's important to screen these children frequently, and particularly after the pandemic, I would request all the parents to get a complete eye test done for all the children, because most we see almost like a myopic or a keratoconus pandemic after the 2 years of lockdown. Having said this, I would like to sign off, again insisting that just avoid rubbing your eyes and use good lubrication if you have any itching in the eyes. And if in spite of that you continue to have itching, please see your local ophthalmologist and get prescription drops. Thank you.